Adrenal glands sit on top of each kidney. You'll notice in this drawing, an adrenal gland has two major regions, the outer adrenal cortex and the inner core, which is known as the adrenal medulla. We use cortex and medulla quite often when organs have different regions, an outer cortex and an inner medulla. We're going to look at the fact that the adrenal glands are like four glands in one, in that there are four different types of tissue producing four different classes of hormones. There's a layer known as the zona glomerulosa, which produces mineral corticoids. There's a layer called the zona fasciculata that produces glucocorticoids. There is a layer called the zona reticularis that produces androgens. And then finally, the adrenal medulla produces epinephrine and norepinephrine. So these are four layers moving from superficial to deep. The first three layers are found in the adrenal cortex. The deep layer is in the adrenal medulla. Let's look at the first class of hormones known as mineral corticoids. That word tells you two things. One, it has something to do with minerals. Two, corticoid comes from the fact that these hormones are produced from the adrenal cortex. The main mineral corticoid is called aldosterone. Aldosterone is a steroid hormone, therefore it's lipid soluble. It is produced when the body has a high potassium level in the bloodstream, or if the body needs to get rid of sodium and water. So the stimulus is either high potassium or low sodium and water. Because if you look at the principal action of aldosterone, it increases blood levels of sodium and therefore water, and decreases blood levels of potassium. It does this by acting at the kidneys. So aldosterone is produced by the adrenal cortex, targets the kidneys in order to retain sodium and water or eliminate excess amounts of potassium. The next layer, known as the zona fasciculata, produces glucocorticoids. Glucocorticoids tells you that it must have something to do with glucose, and these hormones are produced by the adrenal cortex. The main glucocorticoid is known as cortisol. Cortisol is often referred to as a stress hormone. It provides some resistance to stress, and the stress is more of a chronic stress an individual might have. It's also under the control of ACTH, adrenocorticotropic hormone, which is produced by the pituitary gland, the anterior pituitary gland, to stimulate the release of cortisol. Let's look at the primary functions of cortisol. It increases protein breakdown. It stimulates gluconeogenesis. That's a fancy word for producing glucose. So it will stimulate the production of glucose, therefore increasing blood sugar. It stimulates lipolysis, breaking down of fat. Helps provide resistance to stress, but in doing so, it often will decrease inflammation and depress immune responses. This is an important function of cortisol in that we take advantage of this and synthesize cortisol synthetically. It's known as hydrocortisone. You may have heard of hydrocortisone. We put it in topical lotions to reduce inflammation on the skin or in the skin. We inject it into joints to reduce inflammation in joints. There are a whole host of other corticosteroids that are used to reduce inflammation, and they're all somehow related to cortisol. So if you've ever taken a steroid because you have inflammation maybe in your respiratory tract, that's a similar molecule. These are steroids that have a number of functions in the body, but we take advantage of one of the functions being anti-inflammatory or immunosuppression. So as a drug, cortisol, hydrocortisone, prednisone can reduce inflammation and reduce the immune system. The next layer, called the Reticularis, produces a group of hormones called androgens. Androgens are precursors to sex hormones. They assist in early growth of axillary and pubic hair in both sexes. In females, they contribute to libido and are the source of estrogens after menopause. So a lot of times you think of these sex hormones as being produced by gonads, ovaries, testes, but there's a small amount of them, these precursors, androgens, produced by the adrenal cortex. Finally, the inside of the adrenal gland, known as the adrenal medulla, is an amplifier of your fight or flight responses. These hormones are produced by cells called chromaffin cells. These chromaffin cells are stimulated by sympathetic neurons. So we remember the sympathetic nervous system from A&P1. The sympathetic nervous system induces fight or flight responses, such as increasing blood sugar, increasing heart rate, increasing blood pressure. The adrenal medulla is often referred to as an emergency gland. It produces epinephrine and norepinephrine as hormones to enhance the effects of the sympathetic division of the autonomic nervous system. This is more of an acute stress. If you were to get in an accident and need to increase your blood sugar and blood pressure and oxygen in order to survive that situation. The next video, we're going to stick with the pancreas, as there's a number of important features of the pancreas to understand. So we're going to do a separate video for the pancreas.